Hello, everybody. Good morning, good afternoon, good evening, wherever you're watching me from. It's the cold and flu season, and a lot of medication errors are taking place. And so, this video is to spotlight those medication errors and help you avoid them. If this is your first time seeing me or even seeing my video, you're welcome. Thank you to my subscribers, my new subscribers. Ensure to, like this video, give it a thumbs up if you find it helpful. Don't forget to share with family and friends. And lastly, please subscribe. It is free. Here we talk about medication safety. I am a Nigerian pharmacist practicing in the community, and I share my experiences here. So let's get right into it. So cold and flu, right? Over time, or on a daily basis, while we're practicing, people walk into the pharmacy and I've used antibiotics, this cough is not going, the cold is not going. For the obtained time, antibiotics is not your way out. So what most people want to treat is the symptoms like the cold they're having, the running nose, the nasal congestions, your nose is blocked, you can't breathe properly, it makes you uncomfortable, and that's the symptoms that people really want to treat. And if you're actually treating the symptoms, right, you do not need an antibiotics for these to go away. Over the counter medications are available, and so the first mistake is do not take antibiotics for cold and flu. Most of the cold and the flu you're experiencing most times are caused by viruses. And so if you're using an antibiotic, you're actually wrong, because it's not a bacterial infection, it is caused by a virus. And most times cold and flu caused by virus can go on its own, even without you treating. But what most people want to treat are the symptoms, right? Like I said earlier, the cough, the cold, the runny nose, the nasal congestion, right, the sneezing, basically the discomfort it comes with. So don't run to antibiotic as your first as your go-to medication, right? So what you should do is, show up at the pharmacy, show up at the hospital, you'll be given the right medication, ask questions, be transparent, let them know exactly what you're going through, and then the right medication is going to be recommended for you. Don't choose to self-medicate. Don't choose to run to antibiotic. That is not the solution. So that's the first one. Antibiotics would not treat your cold and your flu. So use the right medication for the right condition. Number two, people are trying to treat the different symptoms that come with the cold and the flu. They end up taking lots of medication, probably one for the sneezing, one for a cough, the other for sore throat, and all of that. And you're not checking what those different medications contain. And most cold and flu medications contain paracetamol to help with the headache and the fever that you may be feeling. And so if you're taking more than 2 or 3 medications at the same time, you may be taking an overdose of paracetamol, which can actually lead to liver damage over time. So what do? Instead of taking a lot of medications on your own, ensure that you consult a pharmacist before you take any medication to relieve you of the cold and flu symptom. Aside from consulting a pharmacist, whatever medication you buy on your own, right, ensure that you read the label so that you know what it contains. But instead of stressing yourself, the pharmacist is there to help you as the medicine expert. So know what you're taking so that you're not taking an overdose and you're not putting your liver in harm's way. The third one is use age appropriate medication. Don't use the adult formulation for children. Probably the whole family is down with cold and flu, and because you used the medication and it worked for you, you feel like, oh, I can also use this for my child. There are age appropriate medication for children, so ask at the pharmacy when you go there Ensure that your child is taking medications formulated specially for them, and not taking adult dose, or and not taking the adult dose, so that you do not end up putting them in harm's way more than the good that you're trying to do. The fourth one is cold and flu medication. Most times, some, right, are non-drowsy while others are drowsy. So if you're someone that goes to work in the morning, you operate, machines, you drive yourself to work, ensure that you ask for non-drowsy medication so that you do not sleep off while you're driving to work in the morning after taking the medication. You know that you want the cold and the flu symptom to be resolved, but you don't want to die because because you're trying to, get better. So ask for the non-drowsy medications. If you're someone that is working, you're driving yourself to work, or when you're at work, you operate machines, so you do not sleep off while operating those machines and putting others at harm in harm's way, right? And for the drowsy medications, you can actually take them if you are at home, or you've been permitted to stay away from work because you're not feeling too well. It's easier to take the drowsy ones because it will make you feel sleepy. So what you should do as a patient is, while you're buying medications at the pharmacy, ensure to know if your medication is drowsy or non-drowsy. Ensure to let your pharmacist know if you're working or you're not working, so they can give you what is appropriate for your your condition or your situation, if you're working or you're not working. And then, as a pharmacist as well, ensure to always tell your patient which one is drowsy, which one is non-drowsy. Now, this doesn't apply to only adults, even for children. You're giving a medication to a child. There are children that are going to school. So imagine giving a child that is supposed to be focused in school a drowsy medication, and then the child is not concentrating in school. You have succeeded in making that child better, but also succeeded in making that child perform badly in school for the day. So ensure that you know what you're taking for your child, you know what you're taking as an adult. If non-drowsy is okay for you, go for it. If drowsy is also okay for you, also go for it. And then lastly, the last point is, do not mix your cold and flu medications with herbal concoctions. In Nigeria, they call it agbo. Just, mixing it together can result in interactions with your drug that may not, do you any good. If you're taking your cold and flu medicines, focus and take your cold and flu medicines. If you really believe so much in your herbal concussion, because we've preached and preached and preached against it, but a lot of people are not listening and want to stick to it, then stick to your herbal concussions. But if you have decided to take your cold and flu medications, then take it as you have been asked to. Don't mix it with any herbal concussions, so you can get the result. Because most of these herbal concoctions, you don't know the constituent, you don't know the right dose to take, and it's actually putting your liver in harm's way. So if you're taking your cold and flu medicines, ensure that you do not mix them with any herbal concoctions. Always ask questions, right? Your pharmacists are there to help you. Don't be afraid of health professionals. We are there to provide help, we are there to provide directions, especially when it comes to your medicine. So always ask questions, read the labels of your medicines. Whatever you do not understand, get back to the pharmacist, and you're going to get full explanation, you're going to get clarity, so that you're not confused. And don't forget, if you found this video helpful, please give it a thumbs up. Don't forget to share with friends. And lastly, please subscribe. It is totally free for more medication safety tips. Until I come your way again, my name is Matilda Inibe, and it was a pleasure being on your screens. Bye.